know. Hey YouTube, what's going on? This is Big Girl Don't Care, now Sabali, because I'm patiently waiting for something. No, I just want patience. I just want patience, honestly. Anyways, I'm making a blog talk because this is like really near and dear to my heart. And it's in regards to prior authorizations. Like many people know, people who have gone to the hospital and needed a surgery, needed medications, um, needed physical therapy, certain things you would have to have a prior authorization. And what happens is the prior authorization, I'll show the video. There's a video. I re-recorded it so nobody can't get me for a copyright. So I'm going to show y'all the video.
And this is how health insurance works. Today's topic is prior authorization. So believe it or not, you must get permission from your health insurance company for certain tests or procedures or medications. And if you do not get permission, the insurance company won't pay. So what are some example tests? Things like MRIs, CT scans, cardiac stress tests. What are some procedures? Spine surgery, joint surgeries like total knee and hip replacements. For prior authorization, sometimes it's for medications as well, typically for more expensive medications. An example might be Humira, which costs several $1,000s a month for rheumatoid arthritis, or even for medications that you're given at the hospital or doctor's office, like chemotherapy if you have cancer. Now, here's the tricky part. Oftentimes your doctor or the hospital, they do not know what requires prior authorization and what doesn't, because they're dealing with so many different insurance policies. They have no idea. So the best idea.
So that's pretty much how the prior authorization goes. You put in the prior authorization, right, and it has to meet certain medical necessities. Now, prior authorizations, it's for the insurance company. It protects the insurance company from money being spent unnecessarily, but we vilify it, and we vilify it because doctors and doctors' offices don't want to do the groundwork. But unfortunately, a lot of reasons why we have prior authorizations is because of doctors' offices not coding or not billing or doing unnecessary procedures on our members. It looks like in recent time, and I'm going to say in the last maybe 6-7 years, the office reps, clerical reps, the regular office girls with no certification, they're lazy. And they trick these people to think that the prior authorization is all on the insurance. Insurance don't want to pay. Insurance don't want to pay. Now, for medications, it might be a little tricky, so I'm not going too much, it applies to both of them, because when prior authorizations with medications, they want to know the reason why the doctor prescribed this particular medication, which also protects the member, because y'all don't know, a lot of people want to put their love and honor and their hope and dreams into the doctor. But in actuality, I hate to say this, doctors lie. Not all doctors, but some doctors, they don't, or should I say, I'm not going to say lie. They don't have all the answers. Some doctors are experimenting as they go as well, especially if they are a new doctor. So some of these treatments, some of these medications and things of that nature, it might not be good for you, or it might not even be something that will directly affect in a good way whatever you were diagnosed. It can actually harm it. So I'm not going to be against prior authorizations at all. But what I am against is these girls in this office who don't have certifications, because that's who it mainly comes from. These young women in these offices who don't do the groundwork, and they make it's already a headache. I'll say, quote unquote, a headache, because the doctor's office has to get the prior authorization in order to treat the patient. And sometimes most times they need immediate response, which most prior authorization companies have an access where you can get an immediate response. But it's one thing when you have to deal with it and you're doing it the proper way. It's another thing when you just don't do your job. You don't research. All prior authorizations companies, they have the medical necessity, what they're looking for in order to get the prior authorization. All these companies have a preclinical questionnaire, meaning you can literally get your prior authorization. You can literally get it. I'm sorry, I forgot. I'm running out of time. I don't want to make this a long video, but you can literally get your prior authorization approved on the spot on the phone, depending on how they answer the questions. These women in the doctor's office are lying to the members, telling them mind you, a prior authorization only take a matter of 2 to 3 days. Less than that, less than 2 to 3 days if everything is in order. The clinicals are in order or they answered the questions correctly. But what I'm finding is these girls and guys, some guys, they're not doing their work. They're prolonging the prior authorization. They know that the prior authorization is needed. Before they put it in, they tell these members, oh, it's going to take 2 weeks to do this, two weeks to do that. In actuality, they lying. So they're prolonging the prior authorization, not because of a policy or a procedure, but because of pure laziness. And I'm sick of it because people call, or I talk to people all the time and they're like, oh, my doctor told me it takes 2 weeks to get a prior authorization. That's a lie. Oh, my doctor don't want to send in the clinicals for my prior authorization, or the doctor don't want to call in and speak to another doctor to get it approved. There's so many things that they can do to get these prior authorizations to go through, but yet they refuse. They refuse, and then they lie to the members. Not only do they lie to the members, they don't do their job effectively, which is fatal to a member, literally fatal. Now, a lot of members are calling and say, is it my problem? Listen, it's not your problem, but if you want things to get done properly, you need to research. Do not rely on the doctor's office to do this for you. You research, you get the information, you see what's wrong with you. Look at the diagnosis of what the doctor gave you. Look at your what do you call the symptoms. See what you need to do to get things going on the road, because if you don't, unfortunately, some doctor's office, not all, because you could be blessed to have an excellent doctor's office, but some doctor's office will take their time on your health. So it's not about, like I had one man go, is it my problem? Sir, it's not. Your health is your problem. That's number one. So yeah, it will be a problem if they're lollygagging on your health and you're waiting for them instead of taking action. Then yes, unfortunately, I hate to say it, it is your problem. We can't rely on, times are different now. People are not doing their jobs. People are not caring. I hate to say it, this younger generation is not being properly trained. Everyone wants a new way of doing things. But if you get the foundation, which is the original way, then you can see the other ways and da 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 da. But they're not even training people the correct way and policies and procedures on doing things. All they're doing is hiring them in these offices. Sometimes it's the child of a woman that worked there for 30 years. She wasn't worth anything in the office. Now her daughter ain't. It's a lot. And I'm not taking anything away from these insurance companies. I'm not defending insurance companies. But what I will say, there's a pro and there's a con to everything. There's a reason to everything. Prior authorizations didn't come in. So insurance companies losing money and doctors are gaining money. People are dying. So in a way, having stipulations is helping you. Not only is it helping the insurance company, but it's helping you too. And what you need to do as a person who is worried about your health, or who is in the doctor or currently getting treatment, you need to sit on that bed and read for yourself. Ask the Lord to give you guidance. I do it all the time. I was recently sick. Not sick, but thank you, Jesus. But I had my leg. And the Lord led me to everything that I needed, and everything that my beautiful surgeon, because he did a wonderful job one time for that doctor. Everything that my doctor said is what the Lord already told me. And I'm being honest. I researched, I seen my symptoms. I already knew what was going on. I just needed the hands of a doctor to perform it. And he looked at me and he said, oh, your BMI. And I said, look, doctor, I need to walk again. And he said, okay, we got this. And that was it. So it's hard during that time, but I still push through, and we as people, we can't depend on someone else. And yeah, you have a lot of nurses and doctors. Oh man, one time for the nurses, we love you. One time for the doctors. But you have these people in the office who they don't care. Your life is not in their hands. Put it that way. They're not the doctor. They're not the nurse. They're not the anesthesiologist. So they kind of don't really care. But them not caring is prolonging your health. And it's unfortunate. And not all doctors' offices are like this. I'm just speaking to the ones who know they're lazy, who know they're not doing their job effectively, proactively, who know they're not putting 100% and taking care of patients. That's who I'm talking about. These receptionists who know they're not putting in that paperwork in a timely manner, who know they're looking at TV instead of making sure that paperwork are going in correctly, instead of sending an insurance company the wrong paperwork. Because that's a HIPAA violation, but that happens. And I know it been happening for years, but like I said, within the last 6 to 7 years, I've seen a aggressive amount. And it's unfortunate. It's unfortunate. But anyways, oh boy, I want to talk about these third parties too, these people from India. And I'm not bashing people from India, but what I will say is there's a complete interpersonal communication barrier between Americans and Indians. And for them to effectively assist us, they need